Myself, Sweety Theresa Dsouza. I am the Assistant Professor in the Department of OBG Nursing, Yenepoya Nursing College, Yenepoya, deemed to be University. Today I am demonstrating fetal skull. Before moving to the demonstration, let's see the learning objectives for the today's class. First one is to identify and describe the different parts of the fetal skull, including bones, sutures and fontanelles. Explain the function and clinical significance of the bones, sutures and fontanelles in the labor and birth process. Describe and explain the different diameters of the fetal skull. The fetal skull is a crucial structure in obstetric care, playing a significant role in the process of labor and delivery. It is uniquely designed to adapt the birth canal through its flexible bones, sutures and fontanelles. During pregnancy and birth, understanding the anatomy and diameters of the fetal skull helps to assess the fetal position, presentation and potential complication. Let's move on to the parts of the fetal skull. The fetal skull bones encase and protect the brain. It has got major three parts, that is vault of cranium, face and base. This is the vault of the cranium, this is the face and this is the base of the fetal skull. The vault, it is a dome-shaped upper portion. It is a dome-shaped upper portion. It consists of bones, fontanelles and suture. It extends from the glabella to the suboccipital region, that is nape of the neck. The face, the area extending from the supraorbital region, that is above the eyes till the junction of the floor of the mouth with the neck. It comprises of 14 small bones. Base, it is the lower portion of the fetal skull. It is a housing for the foramen magnum, through the opening which the spinal cord passes along with the cranial nerves. The bones of the vault, it comprises of frontal bones, that is it got two frontal bones, two parietal bones, two temporal bones, that is the side flat bones and one occipital bones. The suture. The sutures are the spaces between the two skull bones allow the movement during the birth. It has got frontal sutures located between the two frontal bones, coronal sutures located between the two frontal and two parietal bones. These are the coronal sutures. Sagittal sutures, these are the sagittal sutures run between the two parietal bones, and last is this lambdoidal sutures. It is located between the or it separates the parietal bone and occipital bone. The importance of the suture: allow the fetal skull to mold and adapt during delivery, and digital palpation of the sagittal suture during a vaginal examination helps assess the fetal position, engagement and molding degree. I hope it's clear still so far. Next we will move on to the next portion, that is the fontanelle of the vault. We have got 6 fontanelle at the vault, that is 1, 2, 3, 4 and 5, 6. But in the obstetric view, we are only focusing on the 2 fontanelles. The fontanelles are the wide gap in the suture line. This wide gap in the suture lines are called fontanelles. These are the soft spots where sutures intersect and allow the skull's flexibility. The front one is called anterior fontanelle and the back one is called posterior fontanelle. The anterior fontanelle, which is also called bregma, it is of diamond shape and it is formed by the frontal, sagittal and coronal sutures. It closes by 1.5 years, that is approximately 18 to 24 months. Next, moving on to the posterior fontanelle. Posterior fontanelle, it is also called as lambda. It is triangular in shape, formed by sagittal and lambdoidal sutures. It closes by 1.5 months, that is 6 to 8 weeks. Next, we'll move to the diameters of the fetal skull. Diameters of the fetal skull are divided as longitudinal and transverse diameters. The longitudinal diameters of the skull include, that is, some 3 diameters from the occipital region and 3 diameters from the mental region. The first one is a suboccipitobregmatic, that is, it extends from the nape of the neck to the center of the bregma. Nape of the neck to the center of the bregma, that is 9.5 centimeter. The nape of the neck is also called as suboccipital region. Next one is a suboccipitofrontal, that is again extends from the nape of the neck to the anterior end of the anterior fontanelle or center of the sinciput, that is 10 centimeter. Occipitofrontal extends from the occipital eminence. This portion is called as occipital eminence to the root of the nose, that is also called as glabella, that is 11.5 centimeter. Next one is the mentovertical. It extends from the midpoint of the chin to the highest point on the sagittal sutures or in the vertex, that is 14 centimeter. It is the highest diameter in the fetal skull. Next one is a submentovertical, that is extend from the junction of the floor of the mouth to the highest point in the sagittal sutures, that is 11.5 centimeter. Submentobregmatic again extend from the junction of the floor of the mouth and to the center of the bregma, that is 9.5 centimeter. I hope this longitudinal diameters are clear for you. Next, we will move on to the transverse diameter of the skull, that is transverse diameter. It is called transverse diameter of the skull. First, we will move on to the biparietal diameter, that is extends between the 2 parietal eminences. This portion on the parietal bones are called parietal eminence. This is the biparietal diameter. This is 9.5 centimeter. Next one is the supraparietal diameter. It extends from a point placed below the 1 parietal eminence to the point above the opposite side of the other parietal eminence, that is 8.5 centimeter. Next one is the bitemporal diameter. It is the distance between the anterior inferior end of the coronal suture. Okay, this is 8 centimeter. Next one is the bimastoid diameter, that is the distance between the tip of the mastoid process from this side to this side, that is 7.5 centimeter. So far we have seen the diameters of the skull. Next, move to the regions of the skull, that is vertex. Vertex includes the quadrangular area between the bregma, lambda and parietal eminence. Bregma, lambda and parietal eminence. This portion is called as vertex. Next one is the brow, or it is also called as sinciput, area between the anterior fontanelle to the supraorbital ridges. This is the supraorbital ridges. This is called sinciput or brow. Next one is the face, that is the region from the supraorbital or ridges, or the region from the root of the nose, that is the glabella, to the floor of the mouth. This is the face. Sinciput we have already seen. Next is the occiput, lies between the foramen magnum, that is opening, to the posterior fontanelle. This portion is called occiput. So far we have seen the fetal skull, the bones of the fetal skull, the fontanelles of the fetal skull and the sutures of the fetal skull, and along with that diameters of the fetal skull. So the fetal skull is flexible, uniquely designed to adapt to the birth canal during labor. It consists of three main parts, that is vault, base and face. Diameters of the fetal skull determine ease of delivery, with the suboccipitobregmatic diameter, that is 9.5 cm, being the optimal for the vaginal birth. To conclude, the fetal skull is a vital structure in obstetrics designed to protect the developing brain while adapting to the birthing process. A knowledge on the fetal skull helps the healthcare professional to determine the position, predict the challenges and manage the labor effectively. Thank you.